Hi, I'm Shailja Shah. I'm at UCSD and VA San Diego.
Hi, everyone. I'm Andy Wong from the University of Virginia, and I want to also make mention of Dr. Michael Wallace from the Mayo Clinic, Jacksonville, and Dr. Juha Huang from Stanford University. We were honored to be co-authors on the AGA Clinical Practice Update on screening and surveillance in individuals at increased risk for gastric cancer in the United States. So, Dr. Shah, probably we just jump right in. Can you please tell us why gastric cancer is an important problem for clinicians in the US?
Yes, and I think that is a very important point to start out with because that was the whole motivation for the CPU is really helping clinicians recognize that even though gastric cancer is considered low in the US overall, there are these identifiable high-risk populations in the US that can have up to over 13-fold higher risk of gastric cancer and really could benefit from early detection through endoscopic screening as well as primary prevention efforts through H. pylori testing, as well as eradication.
Secondly, what are the key takeaways about screening and surveillance for individuals at increased risk for gastric cancer?
So I think the first key takeaway is being able to identify who is at increased risk. And we focus the first best practice advice statement on helping clinicians really identify those populations, including immigrants from high incidence countries, individuals with family history of stomach cancer, individuals with persistent H. pylori infection, in addition to other risk factors, as well as other potential conditions too that are outlined in the CPU. And I think clinicians also need to recognize the importance of doing a high quality endoscopic exam and then testing for H. pylori in individuals who are considered high risk and ensuring that they are eradicated of H. pylori.
Yeah, I think for me, it's about going back to the basics, remembering the patients who come across your clinic, maybe at increased risk. And then when you're doing endoscopy, really for all patients, as we've touched on in other CPUs, to really take your time, clean the stomach, do a careful exam, and focus on areas of abnormality that you would target. And in high-risk individuals, use a standardized biopsy protocol like the CINI protocol. Wouldn't you agree?
Absolutely, absolutely. And also in the CPU, we did emphasize the importance of then once you have identified somebody who does have gastric precancer, anywhere from atrophy all the way up to dysplasia, that they really do need to be followed up, and especially highlighting the importance of risk stratification to determine what the most appropriate follow-up should be.
With that, I think we're at time. Thank you, everyone, and please take a look at our AGA clinical practice update. We hope you enjoyed this short presentation.
Thank you so much.